The Subcommittee on Health will now come to order. The chair now recognizes herself for 5 minutes for an opening statement. First of all, welcome to the first legislative hearing of the Health Subcommittee in the 116th Congress. Last week we heard testimony and examined what the devastating effects would be if the case Texas versus the United States were to stand, most especially on those who have pre-existing conditions and the medically complex children who rely on the Affordable Care Act. We also discussed how the Trump administration's sabotage of the ACA and the expansion of junk insurance plans are driving up costs by diverting the healthy out of the individual market and weakening patient protections with pre-existing conditions. Today, the four bills before us address short-term insurance plans, waivers to weaken insurance regulations on the private market, funding for marketing and outreach, and legislation that would require short-term insurance plans to carry an advisory informing consumers what the plan does not cover and what ACA requirements the plan does not meet. It's a top priority of the majority to protect patients with pre-existing conditions. On the campaign trail and in our hearing last week, our Republican colleagues voiced their support for pre-existing condition protections. They asked for specific legislation, and that's what we're here to discuss today. Our first bill will rescind the short-term limited duration insurance or junk insurance policies regulation the Trump administration finalized last August, which expands these junk plans from the current 3-month limit, making them available for up to 3 years. We know these plans do not cover pre-existing conditions. They do not have out-of-pocket and lifetime limits, and they do not protect women from being charged more than men. Representative Castor's bill would rescind the rule that expanded these junk insurance plans. Representative Custer's bill revokes the Section 1332 waiver guidance issued by the administration last October, which weakens requirements of private insurance plans to provide comprehensive coverage at an affordable price. Section 1332 of the Affordable Care Act requires states to meet standards for what qualifies as health care coverage. The Trump administration guidance changes these standards to be less comprehensive and less affordable for patients who rely on private insurance purchased on the individual market. It also allows tax credits, federal dollars, to be spent on these expanded and extended junk plans. My Republican colleagues have been highly critical about funding tax subsidies to help Americans afford comprehensive health insurance, but support allowing more people to access federal money for these short-term junk insurance plans that do not even cover basic services. Representative Custer's bill rescinds that guidance so that all Americans will have health insurance coverage that meets the same standards. We're also considering a bill authored by Representative Lisa Blunt Rochester to restore the marketing and outreach funding the Trump administration cut by 90% in 2017 and banning this funding from being used to advertise the junk insurance plans. An article published in Kaiser Health News earlier this month described how consumers searching online to enroll in comprehensive ACA plans are most often redirected to websites and brokers selling junk plans without disclosing that the coverage will not be comprehensive. And I ask unanimous consent to enter this article into the record. Hearing no objections, we will do that. Federal dollars should not support advertising coverage that will not protect patients with pre-existing conditions. The last bill, my legislation, will require junk insurance plans to display upfront what is and what is not covered so that consumers will know exactly what they're buying. My bill also requires a disclosure that these plans do not meet the Affordable Care Act's requirements for cost sharing and lifetime limits and prohibits these plans from being sold during the individual market open enrollment. I want to be clear about the following. I believe the Trump administration's rule that expanded the maximum duration of these so-called short-term plans up to a year and allows them to be renewed for up to 3 years should be rescinded. I see that I'm over my time, and at this point, I would like to recognize Dr. Burgess, the ranking member of the subcommittee,